joined by Professor Kelly. Today obviously has not been a meeting of the National Cabinet, but I thought it would be a good opportunity. I said to my team this morning that as the week rounds out, it's been an incredibly busy week, but there's also been further very difficult news for the nation over the course of this week. I was here on Monday and we addressed a number of those issues, and I thought it would be an important opportunity to deal with any further matters, but also to update you on a lot of the actions that have taken place over the course of this past week. Before I do that, I think it's important to note a couple of things. There are thousands upon thousands of people around the country right now, each and every day, doing the very best they can to look after Australians. There are millions of Australians at home every day trying to get through, particularly in Victoria and in Melbourne, looking after their kids, looking after loved ones, trying to keep businesses open, trying to keep people employed. But for those directly dealing with the health challenges around the COVID-19 pandemic, and particularly in Melbourne and Victoria, there is an army of people, and there is literally an army of people in Victoria with the support of the ADF. And each and every day, whether it's myself here or Paul and his team, Minister Hunt, Minister Colbeck, as we gather around every single morning and work through the issues that need to be addressed each day, right through to the aged care worker who gets to work and goes through the very difficult tasks, often in a facility they may not have worked in before because of the disruption to the workforce in those places. Those attending at emergency wards, those working on contact tracing, those sitting behind desks working on logistics and support. Joe Buffoni, who's doing just an incredible job heading up the Victorian Aged Care Response Centre. Each and every day they are all just doing their best to ensure that Australians are not let down during this period. And the sad truth is, some days we fall short, and other days we don't. On some days, the pandemic gets the better of us, and on other days it doesn't. And I think we've got to have a reality check about this. There are no absolute guarantees in a global pandemic. There are no absolute assurances that can be provided. I think it's great that Australians have high expectations of the services and standards and facilities, whether it's in a school or a hospital, an aged care facility, anywhere. That's what Australia should aspire to. And that's what everybody seeks to do each and every single day, just as you do as members of the gallery here, and others seek to do exactly the same thing. But it's tough, and the challenges are complex. And no one has had to ever deal with this before in this way. The combination of a global recession, a global pandemic, and how that impacts particularly on the most vulnerable in our community. It's tough, and it's going to continue to be tough. I said that back in March of this year and even earlier. 2020 was going to be the hardest year of our lives, and so it is proving to be. But Australians, I said, would be tested, and we measure up. Some days we wish better than has occurred. But I'll tell you what we do the next day, where there are lessons, where there are things to be acknowledged, you do that. And you set about the task the next morning, and you get about what you need to do over the course of that next 24 hours until the next time. You're back in the same place, working the same issues. That is the attitude that my government is taking, and I believe that is the attitude that is being taken right across the country as people honestly seek to deal with the incredibly complex and often life-threatening challenges that are being faced around the country. So I want to thank all of them for that work. And I want to thank them for the attitude in which they're engaging in their work and their dedication to it. We are indeed all in this together. Over the course of this past week, we've got the news that there are now 188 aged care recipients who have passed away this week. A further 12 today in actual aged care facilities. There's been active cases of over 1,000 residents and over 1,000 staff. But in response, the work that is being done in Victoria, over 400 residents and aged care facilities have been transferred to hospitals now, with the Aged Care Response Centre playing an active role in more than 300 of those cases. And this includes the transfer of a further 14 residents this week. The Response Centre has facilitated communication support for 7 aged care facilities with 859 outbound calls conducted to families of residents, including 682 inbound calls received since the 23rd of July. AUSMAT has deployed 24 members into Victoria who have made 61 visits across 41 aged care facilities to date. They have been assessing existing procedures and boosting infection prevention and control measures, including the use of PPE. 61 facilities have been clinically screened by the Australian Defence Force and Western Health, with an additional 10 being visited today, making 71 COVID-free facilities that had their infection control bolstered. In addition to 2 existing teams already assisting Victoria from South Australia, a further 2 teams of 6 personnel from Queensland, I understand from Townsville, thank you Townsville, and Western Australia were deployed this week to support workforce and aged care facilities. And these teams are nurses, personal care workers, hotel services. 30 staff from Allied Health Services were trained yesterday at Monash University as residential aged care safety officers to support staff in higher risk facilities and safety, facility operations and PPE compliance. 20 Australian Defence Force staff are today being trained in PPE usage and compliance and will be deployed to facilities next week. More training sessions will continue in the coming weeks with the support of the ADF. Overall now we have more than 1,700 Australian Defence Force personnel on the ground in Victoria, supporting testing, supporting police control points, supporting contact tracing and community engagement and door knocking, supporting planning logistics and supporting aged care response. And a team from the Aged Care Quality and Safety Commission is on the ground making daily visits and delivering unannounced on-the-spot checks on appropriate PPE usage and infection control procedures. There'll be more. This will continue. New things will be added. There'll be additional activities, no doubt. And I fear that we will still see things that will occur that we will find absolutely unacceptable, and they are unacceptable. They don't meet those standards, and they're not tolerated by anybody. But the struggles we face and the complexity that is there means that those things have occurred, and we are doing everything we can to prevent them from occurring wherever we can. There'll be no lack of commitment or effort, but guarantees in a global pandemic, if someone's offering them to you, then they're not being straight with you. So I'm going to be straight with you. That's where we're at. We're moving heaven and earth as a country at the moment to ensure that we can deal with this. And we're in the fight, and we're going to win it. It's just going to take a lot of time and a lot of effort. Paul.
Thank you, PM. So the latest numbers I'll just share with you today. So we're up to 22,739 cases of COVID-19 now in Australia since the beginning of this pandemic, those first cases in January. And really sadly, 375 deaths. And as I always do at every press conference, I just give my condolences to those people that have lost loved ones. These are just numbers to some, but they're not to me and they're not to the PM, and all of the people working on this understand what that means, losing a loved one. We've all been there. So 375 deaths today, 680 in hospital. Many of those are, most of those are in Victoria, and many of those are related to exactly the response that the PM has outlined there in terms of what we're doing with our aged care residents. There's 47 in ICU, 31 ventilated. I just really want to stress today, as the PM has done, that we are learning as we go through this process. It doesn't mean we haven't got a plan. We do have plans. We have very detailed plans for aged care in particular. And since the very beginning of this issue, even before it started in Australia, we've been meeting virtually daily. We've had over 170 meetings now of the AHPPC. On almost every occasion we've talked about aged care and the particular issues of vulnerable people, and particularly in the case of our aged members of our community. There have been plans in place, specific plans, very detailed, specific operational plans for dealing with aged care outbreaks and preparing for those and ways to prevent them since the middle of March. And those plans are working in many ways. And I would just like to point out The huge challenges that are in Victoria are related to the scale of this problem. The PM's said the numbers, I won't repeat them, but there are a large number of outbreaks, there are a large number of staff that have been affected, and that has made it difficult throughout. Let's look at the example of Queensland. For example, recently when they had those small number of cases last week or the week before, there was a link to an aged care worker that was recognised immediately, and immediately that aged care resident followed the residential aged care facility followed the plan as had been outlined and has prevented any further spread. And that is the majority of our experience so far in relation to aged care. Mostly we've seen very small outbreaks, either with a single or a couple of staff, a single or a couple of residents, and that's been it. There have, however, with the situation we're facing in Melbourne with large community outbreaks, that has been a very different situation, and we're learning to work through that, including the setting up of very early in that outbreak of the Victorian Aged Care Response Centre, which is working incredibly well in relation to that, in collaboration with all the partners and specifically with the Victorian authorities. So I might leave it there, PM.
Thanks, Paul. Happy to go to questions.
When you established this Royal Commission, you said that it would uncover some uncomfortable truths. It's now found that there was no plan for the aged care sector in this pandemic, that none of the challenges were unforeseeable, and yesterday it said the sector is still not prepared to handle the pandemic. Isn't this a gross failure of governance on behalf of your government?
Well, Mark, I'd make a couple of points in response. First, I'd reflect what I said in my opening statement, and that is every day, every effort is being made, and on those days that we fall short, we're sorry, and the next day we get up and we seek to make it right the next day. The Royal Commission has not found what you've just said. That is not a Royal Commission finding, that is a statement that has been made by the Council assisting. So that is not a finding of the Royal Commission, that is a position that has been asserted. People can make those assertions, I think that's fair enough. I called the Royal Commission because I want all these issues, and I remember some time ago in this very courtyard when we were dealing with some very difficult issues around aged care that related to the pandemic, and I said it's important for the Aged Care Royal Commission to deal with this, so I welcome that. But assertions will be tested. The government has provided its response to those assertions, and the government maintains very strongly that the plan was in place. The plan was in place from March, and indeed going back to January, preparations had been made, and the plan had been updated twice, and that's all on the record. I won't delay the press conference by going into the government's very strong refuting of the points that you've made. Assertions can be made, Mark, but that doesn't make them right.
I mean, you say you won't take up the time, but this is a very important point, isn't it?
Well, there was a plan, Mark. There has been a plan, and it has been updated, and so we completely reject the assertion that there was a plan, not a plan, because there was a plan. So I think we've addressed that issue, Mark. There was a plan that has been given in evidence to the Royal Commission, and we'll continue to provide the facts to the Royal Commission. But what we need to do every day is to ensure that we put that plan into action. I'll tell you one of the things we've learnt during this pandemic. You can have a plan, you can do the training, you can provide the funding, all of this has been done. Then you've got to go back and reinforce the plan, and you've got to reinforce the learnings, and you've got to reinforce the training, and that's what's happening. And that has been our process the entire time. So my focus is what I need to do now and going forward to learn from where there has been things where on days the system has fallen short, and to ensure that we provide against that in the future. But there are no guarantees, and anyone seeking them in a pandemic, I think that will be not something they'll be able to find. It's something we'd all dearly like to provide, but I think you've got to be realistic in a pandemic, and you've got to deal with the situations as you find them, not as you'd like them to be, and that has always been our approach. But I want to be very clear here. The government has made it absolutely crystal clear. The plan was in place. The plan was not only in place, but it was refreshed. The plan was funded. The training modules were delivered, and they are now all being reinforced again. People will make these claims and assertions, and they can, but they also must be subject to the facts, and we'll point out the facts.
Michelle.
While the Royal Commission didn't make any recommendations, something that the Royal Commissioner said he thought should be done was, and should be done now, was to set up this expert unit, which you'll be familiar with the details and the components of what's being proposed. Are you willing to do that now?
Well, what has been proposed effectively is what the government has been doing. And Paul may wish to speak to that. The matters that were raised that needed to be addressed very much mirror the actions that the government has indeed been taking. And I know that there are proponents of particular methods and particular ways of doing things, or particular groups that should be established. What matters to me is simply the action. And the action that is being taken is very consistent, I believe, with what was set out yesterday as a proposal. Paul, did you want to add to that?
Yeah, I haven't seen the details of what was discussed in the Royal Commission, the recent ones that you're referring to. Yesterday's evidence, I've seen some of it, yes, but not the details. The issue is that what we've set up, in fact, in Melbourne, is this Victorian Aged Care Response Centre. In fact, goes to that exact point. What are the issues?
But a national unit with emergency response, with aged care speciality and.
Yeah. So what let's look at the facts though about what's happening. Where are the aged care outbreaks? They're in Melbourne, and so we've put together a team along those similar lines, as I understand is being called for, with expertise in aged care, in emergency response, in infection control, in epidemiology, in nursing care, in geriatric care, communications, etc., to exactly look at the issues that we're facing right now in Melbourne. And the PM has asked, and was discussed at National Cabinet last week, that we look at how we would develop that if it was to occur elsewhere. So at the moment, rather than looking at a national one well away from the action, we're going straight to where the action is required and dealing with those matters.
And there's been no shortage of experts in this area. Geriatricians have been central to the role played by the aged PPC, central to the decisions that the government has been taking, central to the decisions that indeed the Victorian government has been taking in managing public health, infection control experts. They're the ones who've been deploying and advising on the implementation of the measures that have been put in place in aged care facilities. Even now, as we prepare for next week's National Cabinet, the mirroring of those arrangements in Victoria being able to be applied in all other states and territories. I expect that we'll have that plan in place by next Friday report to the National Cabinet. I think it's very important that we remain focused on what the outcome that we're seeking here is, and that is to get the best quality support and services into a system that is very fragile. Why is it fragile? Because there's a community outbreak of the coronavirus in Melbourne. That is why we have the challenges in that system, and indeed more broadly throughout the public health system in Victoria, where that has impacted workforces and impacted the way that services can be delivered. In the rest of the country, thankfully, 7 states and territories, we are not seeing what's happening in Victoria because there is not a community outbreak in all of those other states and territories. That is the cause. Yeah, Catherine.
Minister, you said a minute ago that you intended to be straight. You said that some days the pandemic gets the better of us. So just for perfect clarity, are you saying that the pandemic got better of the Commonwealth's response in aged care facilities? And if the answer to that is yes, then do the residents in those facilities and their families, are they owed an apology by the Commonwealth?
Well, I've already made such a statement from this very podium once. I'm happy to do it again. Where on the days that the system falls short, on the days that expectations are not met, I'm deeply sorry about that. Of course I am. And I know that everyone who's involved in the process who was trying to meet those expectations is equally sorry. On days where workforces are completely stripped from facilities and there's nobody there, and you scramble for a workforce to try and put them in place, and you have ADF officers who go there at 11 o'clock at night to try and clean up the mess, that's not good enough. But they're the actions we had to take to stabilise those facilities in those situations. And so each and every day there are going to be challenges. And on on many days, the success in how they're able to deal with these challenges has been significant. And so they're the good days, but other days are not as good. And that's the simple honesty that I'm offering to the Australian people on that. Of course we're sorry about that. Of course we're devastated by it. Of course it is something that motivates to try and ensure that those issues don't arise again. In so many cases, these are unforeseen consequences and unforeseen issues, and people do the best they can in the circumstances they find themselves.
The lessons then at Newmarch and Dorothy Henderson Lodge, what were the failings that allowed what has happened in Melbourne to take place?
I'd make a couple of points on this, and I've answered this question on another occasion, but I think it's important to answer it again today. The key takeouts for Newmarch, I think, that we were seeking to apply as we were dealing with the crisis in Victoria, which arose from a very different context. We had broad-based community transmission occurring in Victoria. In New South Wales, that's not what was occurring at that time. The infection was able to get into those facilities, and that was dealt with. There were a couple of points. The first one is that the way of handling the workforce was really important. And that was that you didn't completely denude the workforce, so you could keep a continuity of care. Now that broke down with the way that this issue began in Victoria, and I'm pleased that that has been remedied between the state and the Commonwealth Government about when there are public health officers going and telling people to stand down, that there's a coordination that takes place with the Victorian Aged Care Response Centre so they can manage as best they can within a limited workforce and a strained workforce, because a lot of people have COVID who work in this, there and many other parts of the health sector, that you have to manage the transition of your workforce when you have a facility. The other point that had to be learnt from that is how you transfer people out of aged care into public or private hospital facilities. Now that was an issue that came up as part of the discussion of the Aged Care Royal Commission, and there were challenges and issues and a bit of lack of clarity around those matters, and they've been openly discussed. And it was important, that's why we were saying when this was really escalating, it was vital that elective surgery be cancelled. It was vital that we were able to conduct transfers and transfer people out of those facilities so we could bring them back to a manageable level so a quality of care could be maintained. That was another important lesson out of Newmarch. And the other important one, and there are many more, was communications. And right from the outset, Minister Colbeck was tasked with ensuring that we got those communications into families as best we could. Now, we had some facilities there who it wasn't just the nurses and the nurses' assistants and others who got sent home. It was the receptionist, it was the manager, it was the bookkeeper, it was the back office staff, all gone. And families are ringing to phones that don't answer. And so we used Services Australia in those facilities that suffered that to ensure that we were getting outgoing calls to families, to ensure that there was contact being made, and we bolstered the call receiving in those particular facilities that were most acute so people could get a response. Communications in those situations is incredibly important. I think that is, while it has been a very challenging task in a lot of these cases, that has been a priority that we put into our response. So they were some of the very important lessons out of that process. In Melbourne?
Well, you said 188 aged care deaths over
yeah,
the
there's a
last
community
week.
outbreak of the COVID-19 virus in Melbourne. That's where the system received the greatest challenge. We can't ignore that fact. I mean, COVID-19 broke out in Melbourne. It's got into meatpacking plants. It's got into pharmacies. It's got into distribution centres. It's got into hospitals. It's got into aged care facilities. That's what happens with a pandemic. There is not some special force field around aged care facilities that can ultimately protect in that environment. And that's what occurred. And that has caused an enormous disruption in the continuity of care in those aged care facilities. So the Aged Care Response Centre has been vital. And as each day has gone on, the partnership between, and this, I should stress this is an emergency services-led initiative. And it's important for this reason. You have to pull together the health response, the ADF response, the logistical responses, and all of that, and deal with the acute crises in specific facilities. There are more than 350 aged care facilities in Melbourne. We have been dealing with acute responses in about half a dozen. There are many more facilities that actually have COVID cases, but the overwhelming majority, almost entirely, of those cases, of those facilities, are managing. They're managing. It's difficult, but they're managing. So we keep, every day, I have a list of the acute facilities and the actions in every single one of those facilities. Then there is a broader watch list of those which are on a watching brief. And then there are others that are managing well, and then there are those with no COVID, and that's where we've been sending people to check on PPE compliance to make sure we're not getting a spread across those other facilities. But I've got to tell you, it's a battle every day. So lessons applied, but this is a very complex and challenging situation. Thanks.
Last night in WA, emergency legislation was passed to block arbitration by Clive Palmer. That was pretty unprecedented. Given some of the concerns about the constitutionality and legality of some of WA's actions in the past, what's your response to that? Do you take issue with it? Do you don't take issue with it? Was it necessary given
I
30
wish them
billion?
well in dealing with it, and as I've said, I believe Ms Palmer should drop his other case.
While you're talking about short, Prime Minister, while we're talking about short...
Thanks, Prime Minister. A question for you and separately for Professor Kelly. The RBA Governor today said that increasing superannuation to 12% will lower wages, cut spending and possibly cost jobs. Now, you're sitting on a retirement income review at the moment. Do you agree with his assessment, and when will you release that report and your response to it? And Professor Kelly, if I could ask you, cancer diagnoses has dropped about 30% during the lockdowns. And I'm hearing similar stories from heart disease specialists, stroke specialists as well. HealthScope's Chief Medical Officer says that people have been terrified into believing the only safe place to lie is in their home, so they're not going out for other medical treatments. Medical professionals are saying this could cost hundreds, possibly thousands of other lives in the future. So my question is our singular, narrow, at times hysterical focus on the virus costing many other unintended consequences, many other lives? Why aren't our health professionals at the federal and state level talking more publicly about this? And could you in the future, when you do your briefings on the coronavirus cases and deaths, which are very sad, but could you provide a more holistic view on the other consequences of our policy responses as well? The suicides, the mental health issues, the family violence, the cancer deaths, the heart disease deaths, the job losses as well, to give people a full picture of our policy responses to the coronavirus.
Do you want to start with that one, Paul?
It's a rather comprehensive question, thank you. So firstly, we of course, and have many times, and in fact my colleague Professor Kidd has had, I think, his 50th webinar with GPs, primary care and other health professionals this week, and at each of those he has stressed the need to not ignore those other things. You're quite correct. So to our colleagues in the professions, absolutely make sure that people who do have chronic disease, who are at risk of cancer, who are due for immunisations or for cancer screening or whatever it is, that routine care, it must continue. And we've put out those communications before as well to the wider public. Maybe we need to reinforce that, about that importance of not neglecting those other things. Absolutely important. In terms of the consequences of our actions, there's been some actually quite positive consequences outside of COVID. We've talked before about the fact we haven't had a flu season. Normally this time of year our hospitals are full of flu, our aged care facilities often having flu outbreaks at this point. We've had virtually no flu at all since April. So there's a positive side there, and some of the other infectious diseases have also decreased from their normal levels. But you're right, those other consequences, and particularly in Melbourne, it's very difficult, the situation that people are in now in lockdown. That does take a toll. The things you mentioned, mental health, domestic violence, all of those things are of concern, absolutely, and we need to have a balance there, as well as with the economic disruption. That's why we've always gone for our suppression strategy rather than an elimination one, and we can see, what's happened in New Zealand. Sorry to hear their cases, but no one is immune to this. We need to take that balance of what we need to do, but including the economic and social disruption that can occur.
Thank you. I'd add to that by noting that the advice consistently through that the government has received, previously by Professor Murphy, but now Professor Kelly. I remember early on when there were issues around the reagents involved in the testing material and how that might impact on doing things like bowel screening tests and those types of tests. I remember Brendan being very adamant, with strong support, I can assure you, from his Prime Minister, that we needed to make sure we continue to do those screenings. That there were many other health challenges that just couldn't be set to one side. So I don't accept the hypothesis which says that this has been pursued in the narrow way that is suggested. The Chief Medical Officer is the Chief Medical Officer, not the Chief COVID-19 Officer. And both Paul and Brendan have undertaken their tasks looking to the health of the entire population and the many other challenges that are faced. But we can't pretend that COVID-19's not there and go on our own merry way on other matters. Of course, we have to manage all of this together. There are so many moving parts in all of this. And on mental health, I've just come from a Zoom call that I was doing with a number of young people who are working with Headspace, and with Pat McGorry, he was on the call, and discussing the challenge being faced by young people. A young school captain from Melbourne and what he's doing in his school. And the message is the same. The services are there. The services are there. If you need help, that's why we've surged that support. Whether it's in telehealth, I welcome the announcement by the Victorian Government last weekend following the announcements we made last Friday. Surging mental health support. It's so incredibly difficult. And, you know, on the call they were talking about it's not just the young people themselves dealing with the anxieties of what does next year bring when they may be completing university or completing school or just getting to the end of school, as I'm sure Mark understands in his household. It's tough. But they also talk about the pressures on their parents. And as parents, you know, we'll be going through our own issues as we're trying to manage this pandemic. And your kids are worried about you too. And they're worried about your worries and they're worried about your anxieties. They love you. You love them. And, you know, families are really doing it tough to come through this, and that's why we put those supports in place. On the issue of the superannuation guarantee levy, we're very aware of those issues, and that you'd also be aware of the statements that I and Finance Minister and the Treasurer had made during the course of the election campaign as well. There's been a rather significant event since then, but nevertheless, they're matters we're aware of, and they have to be considered in the balance of all the other things that the government is doing in this space. Andrew, you've been very patient.
Thank you, Prime Minister. You've talked today about federal shortcomings. Let me ask you about the Ruby Princess. Putting aside the mistakes that were made by Border Force officers, by a Department of Agriculture, by a security officer, one thing that's emerged is that there was an inability or a refusal of Border Force and the Federal Health Department in sharing the passenger manifest to allow the airlines to stop passengers, potentially infected passengers, travelling Australia and travelling the world. Can you pledge here that you will ensure at least a protocol is established so that that cruise ship manifests are shared with those who need it, including airlines?
Well, Andrew, I'll put the assertions in the start of your question to one side because I don't share those assertions. I'm talking about the earlier points you made. In terms of the issue you've raised about the sharing of manifests, well, you'll be aware of the privacy restrictions that apply to the sharing of those details. And so it's appropriate, I'm advised, for the ABF to have alerted and shared information with the relevant state health authorities who provide that interface. Paul may want to add more to this because I know he's had some briefings on this as well. So the handling of people's personal information, in other circumstances, I'm sure you would be asking me questions about if that sort of personal information was shared contrary to the restrictions that are placed on that by governments, you would rightly take me to task over that. And so the ABF has to operate within those guidelines like any other government agency and any other government department. In this case, it worked through that channel, as I'm told, and if there are improvements to how that could be done more swiftly, then certainly I would expect the ABF and any agency of government to do things as efficiently as possible. But they, as I'm advised, they were following the protocol that was there. Paul, was there anything to add to that?
Not really, PM. The Ruby Princess inquiry will be handed down, I believe, this afternoon, and we'll look at those matters very carefully. Only just to reiterate the PM's comments about privacy and the importance of that. We have very good and well-oiled and many times practiced procedures for sharing data with our state and territory colleagues, and that was done at the appropriate time. And we work very closely with Virgin and Qantas in other ways, but not in this one.
Yeah. Okay, thank you. Yep. Welcome back.
You spoke to Indonesian President Joko Widodo last night
I did.
about the coronavirus pandemic. Now, some of that country's most eminent epidemiologists have said there may be up to 1 million cases in the country, which is 10 times the official figure of around 128,000. Does the Australian government share those concerns that the infection rates could be higher and that low testing isn't picking up what's really going on there? And secondly, did the Australian government offer any additional assistance above and beyond what we've already offered?
Well, last night's call was an opportunity to catch up, as we often do, as close neighbours and friends around a whole range of issues. We obviously discussed in some detail how both countries were travelling in relation to COVID-19, not just the health impacts, but also the economic impacts on both countries, and those impacts in Indonesia are very serious as well, as you'd know. We will continue to support Indonesia in every way we can. There were no additional measures that I advised the President of last night, but this is an ongoing conversation. We've already provided a range of supports in the tens of millions to Indonesia, and we've also been reframing, not just with Indonesia, but many other countries, our existing development support aid packages to be very focused on their COVID response. In many countries that don't have the same health systems as ours, then obviously the ability to have as close a read on the extent of the infection and the spread, there is a clear gap. Now, that's not a criticism, that's just a reality. And so one has to take that into account when you're considering what the scale of the pandemic is in any of those countries. Now, that's as true as when I was having the same discussion, while very different countries at very different scale and nature, with Prime Minister Marape, who neighbours Indonesia. And James was, very, I think, aware of the limitations of how their data might be able to reflect what's occurring. But the responses are the same. You assume that it is having a devastating impact, and it clearly is. And that means how we can support them with their health response and otherwise is very important, and we'll continue to do that. Yeah. Phil?
A couple if I could, just on the pandemic response. Yourself and your ministers have been urging the states to borrow more and help pick up the cost of the response. Phil Lowe said this morning they should not be worried about their credit ratings, just borrow what they should and spend. Is that a sentiment you would share? And just separately back to aged care, for years there's been controversies with federal managed aged care facilities. I can remember the kerosene baths on that old, but is there a cause or is it too simplistic to consider a total restructure where you just remove the Commonwealth from the aged care sector altogether and give it to the states who by and large have done a better job of administering that sector? Of the
aged care sector. Well, let me come to that point second. In terms of, the Reserve Bank governor today, I think, did issue a call to the states. He also acknowledged that the Commonwealth government, the federal government, had done some very serious heavy lifting when it came to fiscal support for the economy, which I remember back in the meeting we held in mid-March out in Western Sydney, where Phil Lowe joined the last meeting of COAG and the first meeting effectively what became National Cabinet. And he made this exact point when the pandemic at that stage had not moved to anywhere near what we've seen since then. And so that advice hasn't changed, and the Commonwealth certainly has responded to that in a way that no federal government in this country ever before. And the states have equally, I think it's around about $45 billion in both balance sheet and direct fiscal support. The Commonwealth is well over, it's about $316 billion. about 15, just over 15% of GDP. And so where the states are in a position to go and provide further fiscal support into their economies, then that's clearly what the Reserve Bank Governor has advised, and it's certainly what the Treasury Secretary has advised our government. But it's not a blank cheque. It's not, a licence to make whoopee with taxpayers' funds. That's not what that is. The projects have got to be good projects. Spending must always be good spending. Spending almost must adhere to the principles of fiscal responsibility. For example, we would love to do more water infrastructure projects in Queensland. That would be a very good thing to work together on, and that would be a very good way to apply state debt to those projects. I mean, in Queensland there is a view about asset recycling, and I respect and understand that. It's actually a bipartisan view in Queensland going into this election. So were they to be applying those sorts of debt funds to those types of projects which had an enduring value. Equally, I acknowledge what the Queensland Government have done in terms of their loan support for Dreamworld. Now, that's entirely an operation sitting within Queensland, and it was for the Queensland Government, I think, to respond there, and they have, and good for them. Equally, in Victoria, they moved on short-term visa holders, and we've supported payments to those in that type of work who are Australian citizens and residents. So that's a good balancing, I think, of the government at a federal and state level doing the bits that they're responsible for. But spending should always be done carefully because it's not their money, it's the taxpayers' money. And it needs to be well-purposed and have a clear objective, and it needs to be delivered in a way which achieves that objective. But there is no doubt that the Commonwealth Government cannot do all the fiscal heavy lifting on its own, even with our much greater revenue-raising capacities. Even when you take that into account, we're a long way out in front. But I know the Treasurer is having similar discussions with his counterparts today. The Aged Care Royal Commission I called for the reasons I think you've set out, Phil, that this has been a long-running, complicated issue for governments. And I remember those days too as well that you referred to. There is a generation of problems that each government has sought to try and deal with. And for much of that time, I remember when we were opposition, we were very supportive of changes that the then Labor government made. We saw it as a problem that we had to deal with on a bipartisan basis, and there were some very unpopular things that they did, and we supported them because we thought they were making a good, genuine effort to fix this problem. And I have the same approach now and welcome any support we would get to pursue what would be important changes. But I want to see the Royal Commission do its job. I'm looking forward to receiving their recommendations. That doesn't mean we'll be standing still in the meantime. We'll continue to deliver more than $1 billion extra every single year into aged care. We will continue to increase the number of in-home aged care places that we can provide. We will continue to look at the resourcing necessary for the compliance work that needs to be done. The pandemic exposes weaknesses. That is in some ways in many ways unforeseen. In other ways is very disappointing. But we're dealing with a system that is now dealing with a very different demand than it had even in the times you're talking about. People, when going into aged care now, it's hard because we make the decisions when we make decisions about loved ones going into aged care these days. It is very much at a stage of pre-palliative care. And that is a very different proposition in terms of the facilities, the workforce, the clinical needs to what it was 10 years ago, 5 years ago, 20 years ago. And the system needs to be adjusted to be able to meet that at a clinical level. And where delivery models need to be changed to ensure that it can do that, that's what we want to do.
Prime Minister, on March 15, just before the Ruby Princess docked, you said that you wanted the Australian Border Force to be in command of the arrangements for cruise ships. Since then, we've seen a long debate about responsibilities. We've even seen the Australian Border Force put out a statement which I'll read to you. Human health is not the responsibility of the ABF. Was that your understanding when you put them in command? And is it true that the ABF is not responsible for human health?
Well, if you're looking for a doctor at the ABF, you won't find one. That's not their job. In the same way that I have someone down at the Victorian Aged Care Response Centre who comes out of Emergency Management Australia. They're not a geriatrician. There is a mixture of leadership responsibilities and capacities that exist. That doesn't change the fundamental responsibility of the agencies and their tasking. So, I think... Sorry?
They have a Surgeon General.
No, well, if you go down to the Border Force office at the airport, you're not going to find someone doing medical checks. That's not their job.
For human health.
That's not their job. That's not their job. Public health is a responsibility of the state jurisdictions. That's very clearly set out. That's who is responsible for delivering public health in those state and territory jurisdictions.
So they had no responsibility when those passengers were getting off the Ruby Princess to consider human health in that situation.
That is, as the Home Affairs Minister has made very clear, and as the Border Force Commissioner has made very clear, that exactly sets out what their responsibilities are. Now, the Special Commission will hand down its report later today, and we'll deal with that and take the opportunity to review that and see what they have to say. I'm sure they'll touch on all those issues. Yep.
On state border closures, Australians living in regional areas have been disproportionately impacted by these. They can't get to medical care, they can't go to work. There's a woman I spoke to in Canberra today, she can't get down to see her daughter who she needs to look after having a caesarean section. Do we need to see more compassion and common sense about the way these border closures are being managed?
Look, I know this is causing a lot of difficulty, particularly in the border towns along the Victorian and New South Wales border and the New South Wales South Australian border and the New South Wales Queensland border. Now, the circumstances of how those borders were put in place are all quite different. In the case of New South Wales and Victoria, that was done in agreement between both of those states, and the Commonwealth was involved as well. I had a discussion with the New South Wales Premier earlier today about this, and a very positive discussion. And I know that the Premier is very aware of the sorts of issues that you're talking about, particularly in border towns as they relate to accessing medical services from those areas, as well as agricultural workforce issues, shearers needing to get in. The Premier is very aware of this, and I'm very confident that we'll be able to get a practical resolution to those issues. We had a good work through on those. I'll be looking forward when next I can speak to the Queensland Premier. There are some real issues about people in northern New South Wales being able to access medical services. Now, that circumstance is a bit different because the Queensland government placed that border, and so it was a very different way of doing that. What I'm keen to do, these are matters for the states, but where I can assist and the federal government can assist in trying to resolve some of those issues for people in those areas, then we will seek to do that. And I think it is important that there is a practical approach. The risks are very different too. When you're looking at what is occurring in Victoria, then obviously the outbreak there is far more severe than any other part of the country. And I'm sure those living in border towns would completely agree that if someone had gone from one of those towns and gone to Melbourne and come back, well, they shouldn't be going in to New South Wales or something like that. But those who have been in an area that's largely COVID-free, and the testing regime in a lot of those areas has not been as extensive because the risk has been a lot lower. You'd expect it to be higher in areas where there's been bigger outbreaks. Now, in those areas which are largely COVID-free, obviously the risk is less, but if measures can be taken together with the New South Wales and Victorian governments that can give a greater degree of confidence of people moving through and accessing medical services and work, then I think common sense will prevail. And I would hope common sense can prevail whether it's on the South Australian border or the Queensland border. But I stress the only border that the Commonwealth has been involved in setting has been with New South Wales and the Victorian government. Where other governments have put arrangements in, I understand that, not taking any issue with that, but it's important that when they do so, they work through the practical issues that it can mean for people who need to move across borders. Now, one area that we're going to have to address, given the way that the pandemic continues to, who knows where we'll be in November or December of this year, but you know that during bushfire season we have to move bushfire fighters between jurisdictions. There is ADF movements that occur between jurisdictions. There are a range of quite complicated issues that could be experienced if those issues aren't resolved. And look, I'm sure we can resolve them, but we're very mindful of them, and I'll seek to ensure that the states work together to resolve some of these problems that have come about as a result of those borders. Yep.
Follow up on aged care, can I ask, the council assisting also suggested that there was a degree of self-congratulation and possibly complacency that crept into the Commonwealth response on aged care a couple of months ago when it looked like the virus was under control. Do you accept that and take responsibility for that complacency in dealing with aged care that was suggested that might have crept in a couple of months ago? And second, last week at the National Cabinet there was the audit flagged of state and territory preparedness for aged care all around the country. A lot of people probably would have been confused that that hadn't been done sooner. Why is this only being done now?
Well, first thing, no, I don't accept that assertion that was made. Where there have been failings, where things have fallen short, I can assure you it wasn't as a result of complacency. Those who are doing a professional job each and every day are doing the best job they possibly can. And so, no, I don't accept that reflection that was made against all of those hard-working people. That has not been the attitude of our government and will not be when it comes to the very serious issue of protecting the life of elder Australians in the places where they receive care. That's someone else's opinion. It's not a finding, and it's not an opinion that I share. Quite the contrary. On the broader issue, the plan was put in place back in March. The plan was updated. In well over 100 meetings of the AHPPC and the many meetings of the National Cabinet, the aged care issues have been regularly gone over, and sometimes in great detail, and improvements have been made, and there's been discussions about the preparedness of other states and territories, and we saw a very good example of that recently in Queensland, and I commend the Queensland government on the way they dealt with the recent prospect of an outbreak there and how they dealt with the aged care response in Queensland. And so there has been a higher level of confidence in those jurisdictions, and that has been evidenced when they've been tested. And similarly, it has been the case in New South Wales, despite the many outbreaks they've had to face in recent times. We've been able to contain that situation there in New South Wales, and they've done a great job to date on that. But, you know, you can't be complacent about it. You never can, and we never are, and we never will be.
A very brief question. The RBA governor said this morning that he didn't have a problem with profitable...
Who are you talking
about?
The
RBA governor.
Yeah.
He said he didn't have a problem with the very profitable companies using JobKeeper and then passing on dividends to shareholders. Do you care about that?
Well, we obviously want the income support that we've been providing to through companies to be there for the benefit of those workers. It's called JobKeeper for a reason, to keep people in jobs. And that's what its primary purpose was. And we believe that's what its primary purpose should be, both for the recipient and those who've worked with us to achieve that. But you know, I don't really have any further comment to make on that more broadly. I think our purpose about it was very clear, and I think that should be the shared purpose. Okay.
Prime Minister, just on the border closures, industry has been crying out for some clarity as to when a border should close and when a border should open, especially when there's no community transmission. Would you consider taking the leadership on this and setting up some sort of national agreement or principle so that we know when borders will open and close? And just on aged care, are there any learnings from what has happened in Victoria so far to warrant it being the case that any aged care patient or resident who contracts COVID-19 should automatically be transferred to hospital, not on a case-by-case basis?
Well, there's a clinical decision that involves the transfer of any person from aged care to a public or private hospital, and clinicians do make these decisions, and it's based on the circumstances in those facilities. There's a broader principle that would say that when facilities come under great stress, then you would seek to make a number of transfers, but which residents are transferred and in what circumstances and their degree of frailty and the wishes of the family and what arrangements can be put in place in the aged care facility. I think it's very difficult to have a one-size-fits-all approach to that. I'll allow Paul to make a further comment on that. Now just remind me on the other matter. On the border, would you be open? Oh, on borders. Look, I have to raise this with premiers and chief ministers, and indeed if you look at the letter I wrote to Mark McGowan, I set out some very clear principles about what I believe would be a way of ensuring there was greater certainty about how that can be done in the future. And I appreciate what I believe was a positive response from Premier McGowan about how that could be done. And I think it's quite reasonable that people would expect that there's some certainty or at least some process about how premiers are making decisions about when they close and when they open borders. Now, personally, I think the way that New South Wales and Victoria went about that process provided the best model. I've made it very clear to premiers and chief ministers that what we should be focusing on is the containment of the virus. And where there are hotspots, and I've been saying this since March, early March, I mean, the three areas you had to focus on: testing, tracing, containment of outbreaks, defining those outbreaks, where they are and ringing them off. And it's just as important to stop someone from moving out of an outbreak area within a state to go to another part of the state as it is for them to go to any other state. And so focusing on the containment of where the outbreak is has always been, we think, the priority. States and territories, I can assure you though, have been very adamant about their sovereignty when it comes to who sets their borders, and that is a very strong view held by all, I'd say pretty much all premiers and chief ministers. So I can only tell you that there is some resistance to that idea, but constructive suggestions have been made in the spirit of partnership. Thank you all very much. I've already covered that off. That's all been covered off.
Did you make an offer to Daniel